The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance. Office design, practice workflow improvements from the road. As more and more practices begin using EMRs and other software-based applications, it is important to understand the changes which may affect the practice workflow in order to improve the processes with the end goal to improve efficacy. Join us for Office Design Practice Workflow Improvements from the Road. Dr. Reza Sadeghian will discuss the various aspects of improving practice workflow.
This is one of my favorite topics, and this is something that really impacts almost every physician, whether you're in outpatient or inpatient setting. And so what our team tried to provide for this session for you guys is to kind of highlight the importance of understanding what our changes are in our new workflow of medicine, and how can we help you to kind of go over your practice flow and see if there is anything that you're missing, or if there is anything that you cannot think of, or you might think of but you don't know how to go through the process to make the workflow a lot better and easier. For the purpose of the webcast, we have a very limited time, and I hope that our presentation kind of touch those high levels and help you with your practice. But this is one of those areas that it's really hard to kind of narrow it down to 20-30 minutes talk. So I kind of summarize the talk into 6 sections. So the first thing I want to touch base is the change in practice workflow over the past couple of years. And this is the part that physicians struggle. This is the part that actually can cause physician burnout, our first talk into this series. So over the past couple of years, as more and more practices using electronic health record or any other software-based application, we have seen that workflow has become a very important, crucial part of every clinical medicine. Now, that this is very evident that the workflow solution also becoming more and more popular. But the question is really what can I do, and what workflow improvement I can do, and actually what it means to improve my workflow, especially when you're talking about the practice bottom line. So the concept that here we have is what we call it reducing waste. This is the concept that comes from the lean manufacturing by Toyota. It's part of the Toyota Production System, or TPS. They're talking about the terminology called Kaizen. And this is what we're trying to do. And if I would say that we all agree that good solution can help cutting overhead and reduce and eliminate errors and waste, I don't think anybody would disagree with me. This is the same concept of waste and Kaizen. So it's a fundamental understanding in the lean manufacturing. We want to reduce waste. And also on the other hand, I would say, though, to my experience, there are plenty of practices that could benefit from, simply by reviewing and analyzing their current or existing workflow processes, and if with the focus on improving their efficacy. And by doing that, you reduce your waste. And by doing that, in order to do that, you don't need to really spend a lot of money or equipment or software or anything like that. Especially if you're listening to this podcast and you have a smaller practices compared to the larger one. This is something that you can do on your own. This is something that we can help you at SMA to target those without spending a lot of time and money on equipment and software. So what is workflow optimization? I'm going to give you an example of this in a minute. And I like to kind of go back to something that you experience every day. And first of all, to me, it all starts from each individual in your practice. If everyone can do exactly what needs to be done as part of the workflow, everyone follows every key steps as part of their practice flow, then we will see the entire operation goes very smoothly and hopefully flawlessly. Okay. And I would say, based on talking to plenty of experts in the field and attending conferences and listening to many other talks, I would say that your goal should be to avoid waiting for someone else to do their job so you can do yours. How many times has it happened that you could not go to the a specific section of the chart because the MA or the front desk or somebody is working on the chart and they need to close it, so then you can go to your section and do the rest of the charting? I bet it happened plenty of time. So the whole idea here is, how can we put in place a workflow processes that everybody does what they're supposed to do in a timely manner that does not interfere with the work of the next person? And in order to better understand the notion of workflow analysis and management, I would like to talk about the process in your favorite coffee store, Starbucks, or when you go and you go to the McDonald's, and compare that to your medical practice. When you go to the Starbucks or when you go to McDonald's and you place your order, which size do you want? I want, the grande and non-fat latte, and I want 2 pump of hazelnut, and do you want the anything else? Yeah, I want 2 pack of a Splenda. So everything that is itemized on your receipt, as it goes through the process, the person who is in charge of it, they put those items in, and if they follow the same procedures without any missing the steps, then you get your latte that you really like. The same thing with McDonald's. When you go through for instance, through the drive-through and you place your order, the guy who makes the fries put the fries in the basket. The guys who flip the burger does the burger. The other person is filling your juice. These people do not need to communicate with each other. They have the set project ahead of them. That is their workflow. That is what they need to be done. At the end of the day, they all come together and you get your sandwich with your fries and your drink. And nobody is waiting for another person, except the last step that everything comes together. Now, let's compare that to your practice. When a patient comes into your practice, he or she sometimes need to go and sign in that they came in the front desk, and then they go sit down. A couple of minutes later, the receptionist, the front desk staff, they call them again. If they have a couple of questions, they go back, fill out a couple of questions, and maybe they go back and sit again. After a while, going back and forth, filling up other documents, they eventually get sat down in a doctor's room. Then somebody comes and take their intake. And so when you look at different practices when you walk in and how just their front desk staff operates, you will see that the process, the first step of seeing the patient by itself can take 3 to 4 steps before even the patient gets to the doctor's room. And then when you get to the doctor's room, we have other processes. The MA comes, takes your blood pressure. So this is just an example of how the practice can be so overwhelming for not only patient, but also for staff. If you have 50, 60 patients sitting in the waiting room and you're doing this back and forth, you can imagine how much time it takes, because you fill out the form, you go sit down, they call another patient to go do the first step, and the first patient is waiting because she or he had to take that form to the front desk, but the front desk is busy with another patient to do the same process. And then you kind of go between those patients to hand in the form, And if they have any more questions, yeah, please sit down, we'll get back to you. Can I copy your insurance card? And nothing changed. So these are some of the things that I see in the practice flow of this outpatient clinic, that a little bit of modification is really making a big change to the patient and the staff. The other example of some practice flows that can interrupt the normal processes is that, for instance, we're talking about the hospital. I mean, we're talking about the services. For instance, there's a service at the hospital that never get billed. Patient need to check up, they never get called. You did not verify the insurance prior to billing, or seeing the patient for placing an order, certain procedures. All of these can delay the process of your practice. And what I refer to initially as waste and Kaizen, that can create more waste, and that can cause more overhead expenses, and all of which can lead to physician burnout, staff burnout, and evidently decreased profit. So again and again and again, I mean, I'm re-emphasizing that improving workflow makes non-revenue producing processes happen a lot more efficiently, and helps the practice work much more smoothly. Now, there's a notion of paper versus electronic medical record-based practice. If you look at the electronic medical record, the vendors who develop these platforms, these are very flexible platform. You can configure it, you can customize it, and to do a great job. But the thing is, even when you customize it, you will see sometimes that they fail. And they fail not because the system doesn't do a good job. The problem is that people realize it doesn't really fit into the physician workflow. And after a while, the physician has stopped using it. And they want to go back to their own, prior workflow. So one of the things that I would say is that we have to be cognizant of changing our behavior, okay? We have to look in to see what is going on in our practice, what changes can we do that we can integrate that into that software. We can make our workflow looks better, and we can make our workflow more productive. And this is the thing that unfortunately has caused a lot of problem for clinicians. Products that meant to improve workflow management, they can't just simply fit into the existing workflow. We need to make changes to make those also work better. For instance, if your billing manager spent a couple years creating a system and form and learn how to do permission slips and doing other kind of work in the office that was working for them, obviously it's going to be harder because now they have to change it the way the new system operates. But if you look and see what our current workflow is and put a little bit of deeper look into that, maybe that is not the best workflow that we're doing. Yeah, we're doing that. We're having all this paperwork. We just got used to it. But this may not be the best things that can be done. And we're just doing it because that's what we have been doing for many, many years. So I would say the key is a good process is in place. The key is a culture of change. And this is one of the most important topic in Toyota production system in TPS, culture of change. The truth of the matter is that no technology will help if the processes that are placed in your practice is poor. Again, no technology will help if the processes that are placed in your practice is poor. When I talk to physicians and our healthcare colleagues, oftentimes they think that the practices, they believe that they have a problem with the technology. And when I When I ask them more question and get into more detail into their practice workflow, I see that it is not a whole lot with the technology. Yes, the technology has its learning curve. They might force you to do stuff the way that you don't normally do. But I feel like there are also a lot of problem within the practice workflow. An example of that is that, I know a couple of practices and even hospitals that they have piles of denied claims. They have open charts. They have lost so much money and they're blaming it on their billing system. Okay. And then when you look into their processes, you will see, oh, there's so many charts that this individual have not completed. And that goes back a couple months ago. You will see that their insurance coverage was not verified before the claim went out of the door. And the list, goes on. So we should not anticipate technology do everything for us. Improving workflow start from us, start from the practice, and introducing the culture of change. And I would say at this moment, when you're facing with all these changes and challenges in technology, for a moment, just forget about we're going to have this technology, we're going to have this software, we're going to have this new EMR, and everybody's like freaking out. Just think about your processes, your every step processes in your office, from the moment the patient opened the door, come to your waiting room, all the way till you shake hands, they live in your office, you're charting, you're submitting your claim. These are very important steps that needs to be looked into. And there are different part of your clinic, different part of your institution, different part of your hospital that they have to work like the way that McDonald's works or Starbucks works. And you have to look at those processes to make sure that when you get your coffee, your latte, it has everything you want it. And you're not going to say, oh, the latte machine that the Starbucks uses, the coffee machine is a great coffee machine. No, it's the staff behind it. So I share you one of the experience that I had. Traveling from Alabama to Seattle was about, I believe it was about 3,000 miles. And it took me a couple of days. And I said, you know what? I want to try Starbucks in different states as I'm passing through different states. And going through different states, and I always order the same thing. And surprisingly, in some states, I got a different taste. So how is it possible that I'm ordering the same thing? They use the same machine, but there are different staff. Probably they use different milk throughout the country from different suppliers, but their coffee should be the same. I'm guessing their pump of vanilla should be the same, but why the test is different? So to me, it's all about the individual who are working through the system, because the coffee machine, the latte machine is the same. They get it from the same company. So taking this example and applying to the clinical practice, you would see that, we blame everything on the system. And I'm not saying that the electronic medical records, they're problem free and they have their own learning curve. And, in some instances may cause your workflow a little bit out of your norm. But diving deep into some of the complaint that I hear from colleagues, and I sit down with them to go over their workflow processes, I see that there are a lot of issues that are pertinent to their practice and individual workflow that they need that they perform as part of the pieces in their practice. So what I would say is that we need to sit down and look what we do, and that's what we call it current state mapping. So we need to sit down. If I have my practice and I see, okay, things are not going well, or it's not the way I want it, then I will sit down and take a step back and look at each critical function of the workflow processes. And I draw it on a paper. And I say, okay, what am I missing here? And then I propose my future state mapping, which means, okay, I need to change this. I want to design a system that when the patient comes into the clinic, they don't need to go to the front desk 3 or 4 times. Maybe I reduce it to 1 time if I can, if not 2 times. And that's it. When the patient comes to the room, this is what I want the MA to do. So I don't have to do this. This is what I want the other staff to do. So when I get into my chart, all the information is available for me. And depends on what issues you're dealing with your practice. This is how I would sit down and design the future state mapping. Now, we have a link here in our presentation, and I'm sure if you can look it up. It's in our presentation. You can Google it. I'll tell you what it is. Or if you don't have access to our to the computer to see these slides, or if you can't find it on Google, please email us and we will send you the link. This is for AHRQ, which is Agency for Healthcare Research and Quality, and it's called AHRQ Primary Care Practice Facilitation Curriculum. This is a, I believe, like 70-page document, 69-page document that goes over the workflow. What is workflow? What is the current state? What is the future state? When I tell you to draw it, and you might ask, how I'm going to draw it? I don't know how to draw a workflow. I don't know how to look at my practice. So it has a couple of examples, even on page 9 and 10, about the sample workflow processes in your practice from the time the patient comes in, the nurse or supportive staff see them, and maybe your PA see the patient nurse practitioner until it gets to you. Also, it has information about other part of your clinic, making appointments, scheduling, making referrals, educating family and patients, coordinating referrals, labs, registration, all the information that you might need in your practice. So I highly suggest that for those who are listening to this podcast, to take a look at this AHRQ Module 10 document, which is Mapping and Redesigning Workflow. And if you guys have any questions that we at SMA can help you to have a better understanding of your current workflow processes in your office, and if you would like us to give you some advice and help you with redesigning your future state, we would be more than happy to help you.
Want to learn more about these topics? Make plans to attend SMA's Southern Regional Assembly June 27th through 29th in Birmingham, Alabama. Visit sma.org/assembly for more information and to register.